The most challenging thing is that this is what was described as a novel virus, a virus whose behavior was not known and whose cause was not understood. And they had to be very predictive and proactive, and also to very closely watch what was going on in other countries to see what you could learn and to add to your own ability to predict and prepare. And then the fact that it is a virus that spreads so easily and so rapidly, and with the terrifying consequences as we saw in some countries. The private sector is very important. They offer 60% or more of service to Nigeria, medical service. But very early on, when we realized how terribly contagious this disease is, the COVID-19, we advised the private sector to stay off first because there was high risk of being in a position to infect other patients and infect their workers and their staff. And we set up a series of conditions for accreditation. So any private party that wanted to take part in treatment will have to be accredited by a team and inspected to make sure that they were able to deliver service safely, both to themselves and to their other patients and to the community. The role they can play later on, and the role which they are playing now, is to help to mobilize patients for risk communication, community engagement, and directing patients who meet the case definition to go for testing and encouraging them to go for treatment. So collaborating with the infectious disease hospitals, and if they are accredited, they're also participating in treatment. Yes, we have been particularly apprehensive about that, those communities where we know that the density is very high, and because of the easy transmissibility, those people are particularly exposed, and the also poor, relatively poor hygiene. So we've done as much as possible to be proactive with risk communication, community mobilization, with education, awareness creation, and encouraging the use of masks, any kind of barrier, and social distancing, discouraging gathering, and that meant discouraging communal worship, either in churches or mosques, and being able to report immediately someone felt ill, and that person had to be isolated so he doesn't stand a chance of infecting others. We also try to see that we do what they call a cordon sanitaire to keep those communities a bit away from too many visitors going in there, so that the risk is reduced of people carrying the virus into those communities. The relationship between the Federal Ministry of Health and the State Ministry of Health is a collaborative relationship and cooperative relationship. We have different tiers of care delivery and work together. While the NCDC is a federal institution, it has branches and representation in all states. The National Primary Healthcare Development Agency also has representation everywhere, and they work with the state organs. So in the particular case of responding to infectious disease outbreaks, the NCDC is responsible for surveillance, for also infection prevention and control, and for contact tracing, for laboratory work of diagnosis and so on. And we also have the fact that the states, at the end of the day, are also responsible for isolation and treatment. So patients who are positive are handed over to the states. We've encouraged every state to have at least 300 beds of isolation and treatment center free, and at least 10 intensive care units. So the relationship is good. In some places, very good. In some places, it could be better. to have been proactive, to have tackled the viral infection of which nobody knew. The beginning was a guesswork, but nobody knew the cause, nobody knew where it was going, and where you had to use the meager resources you have at your disposal to tackle something that you couldn't predict. But we try very hard to see from learning examples and reading every day which way it will go in our country, and how the various communities, both the densely populated and the sparsely populated, both the young and the vulnerable and the older ones, how we could protect them or how we could keep them apart, and how we could be able to preserve lives, at the same time preserving livelihoods. So yes, we want to know that we did the right thing here, we did the best that was possible. We also want it to be known that we used the opportunity to also start rebuilding the health sector, to start remodeling it, to start learning lessons from what has happened here and apply the lessons for the future.